Good morning, dear students. Today we discussed about dental pharmacology classes. Here there are some important dental pharma questions is usually asking in your exam is dentifrices, astringents, mummifying agents. So today we discussed about this dental pharma. First is the dentifrices. What is dentifrices? Dentifrices, these are the bulk agents. This available as tooth powder, paste or gels, and is used with toothbrush to cleanse and polish natural teeth. They are prepared in the form of bulk powder and is containing soap or detergent and mild abrasive agents. We should have maximum cleansing efficiency with minimum tooth abrasion. So this dentifrices agents are the bulk agents. These are the cleansing agents. These act as a cleansing agent with the help of a toothbrush, and this help to cleanse or polish and gives the natural effects to our teeth. These are the some properties of an ideal dentifrices. An ideal dentifrices, this should assist the toothbrush to mechanically remove debris, soft deposits and stains from the teeth. It should be non-decalcifying and non-over-abrasive to the teeth. It should impart a polished surface to the teeth. These are the main criteria for a ideal dentifrices. And this dentifricer should help to reduce the dental caries, maintain healthy gingiva and reduce mouth odors. It should be non-poisonous to the body as a whole and also to the mucous membrane. They should have pleasant taste and odor and having sufficient cleansing property. What is abrasive agents? Abrasives, these are the fine dental preparations. This mainly used to help the scalding action to toothbrush mechanically. This abrasives is made into a paste and is applied in a tube. Abrasives used in dentistry, this can be classified into mainly three categories. First category is finishing abrasives. These finishing abrasives are hard, corrosive abrasives which are used initially to develop, counter and remove gross irregularities. Examples of finishing abrasives are corrosive stones. Next one is the polishing abrasives. These have the fine particle size and less hard than abrasives. This used for finishing. They are used for soothing the surface that have been roughened by the corrosive stones. Examples of polishing abrasives are pumice, polishing cake, etc. Cleansing abrasives, these are the soft materials with small particle size and are used to remove soft deposits that adhere to enamel or restorative material. These are some commonly used abrasives. Pumice is a highly siliceous material, is a volcanic origin and is used either as an abrasive or polishing agent. This depending on this particle size. It mainly consists of aluminium, potassium and sodium chiefly. This available as pumice with glycerin and its use ranges from soothing denture to polishing teeth in the mouth. Emery, this mainly consist of natural oxides of aluminium called corundum. These different impurities, example iron oxides present in it, this act as the abrasive. Other examples of abrasives are aluminium oxide. It can be replaced by emery for abrasive purpose. This pure alumina which is manufactured from bauxite is an impure aluminium oxide is also used as a polishing agent. Another example is chalk or precipitated calcium carbonate. Chalk is a calcium carbonate. This is prepared by precipitation method. Various grades of precipitated calcium carbonate is available. This depending upon its thickness, weight and odor. These are mainly mild abrasive and is used to give final polish to silver amalgam fillings. The other abrasive agents examples are zinc oxide, chromic oxide, sand, carbides, zirconium, silicate, zinc oxide. These are the lots of examples of abrasive agents. Okay. Next we come to this humectants. Humectants, these are the agents which are used to keep paste from drying out. Examples: glycerin, sorbitol and propylene glycol. This we call it as humectants. This role is to keep the paste from drying up. Detergent and foaming agents, these are also the cleansing agent and decrease the surface tension of dentifrices. Most common detergents used in dentistry is sodium lauryl sulfate. They cause loosening of debris which adhere to teeth and also dissolving fatty substance and mucus plaques. They also act as an lubricant when scrubbed over the teeth. Binders, these are the carboxymethyl cellulose, is the most commonly used binder in the dental preparation. Sweetening agent, this artificial sweetener such as sorbitol saccharin is used as synthetic sweetening agent which is more palatable, having no food value and can be used by diabetic patients. Antiseptics or therapeutic agents, certain antiseptic and therapeutic agents like sodium fluoride, stannins fluoride, strontium chloride, urea, dibasic ammonium phosphate, these are used in dentifrices for their anti-carcinogenic, bacteriostatic and bactericidal actions. Next come to this coloring and flavoring agents. Certain coloring agents like methylene blue, magenta, flavoring agents like peppermint, clove oil, these are used to make the preparation more attractive, palatable and acceptable. Preservatives are these mainly used to preserve the quality, stability. The certain preservatives are methyl paraben, this used in mostly in dental preparations. Next come to this mummifying agents. Mummifying agent is also an important short note question. In dentistry, when astringents and antiseptics are used to harden and dry tissues of the pulp and root canal so that the tissues are resistant to infection. So these are termed as mummifying agents. It is used in certain dental procedure when it is not possible to completely remove the pulp and contents of root canal. For this, generally a combination of various mummifying agents are used in form of paste or semi-liquid preparations like tannic acid, glycerin. Tannic acid is an astringent which is yellowish white to light brown amorphous powder. This mainly obtained from nutgulls produced on the young tinged to Cusius infectoria, which is gradually darkened on exposure to air and light. It is used along with glycerin and it hardens the tissues and precipitate proteins and thereby avoids bacterial action. Parafoam, it is a product, is used in combination of zinc oxide or zinc sulfate glycerin and glycerol. This acts by slow liberation of formaldehyde. It is also used along as abundance. Its main disadvantages is that formaldehyde may penetrate the pulp and this causes the inflammation. This is a chance of inflammation is the main drawbacks. Liquid formaldehyde is also used in the form of paste with zinc oxide, glycerin along with local anesthetics, and this hardens the tissue without causing the shrinkage. Iodoforms, this mainly acts by slow liberation of iodine and has both antiseptic and local anodyne properties. It is used in the form of paste which contains tannic acid, phenol, clove oil, cinnamon oil and glycerin. Toothache drops, these preparations are used for temporary relief of toothache by application of a small pledge of cotton soaked with the product into the tooth cavity. Certain local anesthetics compounds like benzocaine, eucocol or clove oil, camphor, menthol, trisos, alcohol has been considered safe and effective for toothache but restricted its use only for first aid type or temporary relief. Next categories are astringents. What is astringents? These astringents categories acts by precipitating proteins in superficial layers of cells and are used to diminish the excretion or exudations of superficial cells. They are also used as local hemostatics and mummifying agents. So these astringents are basically acts only on the superficial layers of cells. This do not penetrate inside the cells. Tannic acid, it is a vegetable astringent obtained from nutgall. It acts by precipitating protein and gelatin as tannates owing to its acid radical. Tannic acid, glycerin and mouthwashes, gum paint, this containing 1 to 5% of tannic acid is used to strengthen the gums and stop bleeding. Its preparations are used as astringent, mouthwash, astringent, dentifrices, local hemostatic, mummifying agents, obtendants. Under astringents of vegetable origin, this catechu is also used as an astringent mouthwash. Zinc chloride is a caustic astringent used as 5 to 10% solution in ulcerative gingivitis and feral pox and aphthous ulcers. Zinc sulfate is also the examples of astringent in 0.5 to 1% concentration in the form of mouthwash and lotions in stomatitis and chronic alveolar abscess. Copper sulfate is used as an astringent mouthwash in 0.5 to 2% concentration in indolent ulcer of gums. Alum, it has an astringent, antiseptic and hemostatic properties and is used in 1 to 2% concentration to harden the gum or for inflamed and ulcerated gums. Certain other metallic astringents, example ferric chloride solution, lead acetate, silver nitrate, mercury chloride is also used as astringents in dentistry. Next category is obtendants. Obtendants are agents which are used to either diminish or eliminate the dentin sensitivity to make the extraction painless. But due to the availability of local anesthetics like xylocaine for painless extractions, the use of obtentant is very limited. An ideal obtentant should possess it should remove dentin sensitivity and penetrate the dentin sufficiently. It should not stain the dentin. It should be free from any local irritation or pain. Obtentant may be classified in 3 main categories according to their mechanism of action. This acts by destroying the nervous tissues, and examples is absolute alcohol. This acts by paralyzing the sensory nerve endings, for examples like phenacresose, benzyl alcohol, camphor, thymol, menthol, clove oil. Some of this acts by precipitating proteins, for examples like silver nitrate and zinc chloride. Ethyl alcohol, this 70% is painless and non-toxic to the pulp and penetrates rapidly. This does not cause staining of the dentin. It is also applied locally, allow the alcohol to evaporate and carry out the exhavation. Phenol is the oldest antiseptic agent. This on local application it causes irritations followed by numbness. Is used along and in combination with chloroform and olive oil. It acts rapidly but does not penetrate deeply, and due to its protoplasmic poisonous nature it produces its obtendant action. Chrysosis is a characteristics and action is same as that of phenol. In addition, its penetrability is relatively more. Benzyl alcohol, due to its local anesthetic property, it is used as an obtendant agent. It can be used either alone or in combination with chloroformethyl alcohol. Camphor, thymol, menthol, all these are the volatile oils used in a mixture in a ratio of 1:2:1 for rapid action. The mixture acts initially stimulating and then paralyzing the sensory nerve endings. Clove oil is used due to the presence of eugenol as its main constituent. This acts by paralyzing the sensory nerve endings, and it is a non-irritating but stains the dentin yellow. Silver nitrate is an astringent. This causes the pain on the application followed by desensitization. It acts by precipitating dentin proteins and liberating acid and stains the dentin black. Zinc chloride, this mainly action is similar to that of silver nitrate, but it causes sharp pain and does not stain the dentin. Next, come to this disclosing agent is a dye. This mainly used in dentistry as a diagnostic acid applied to the teeth to reveal the presence of dental plaque. Examples are erythrocin is most widely used. These erythromycin tablets are dissolved into this solution or chewed to dissolve in the mouth. It stains the plaque area red, and but it also causes the stain soft tissues. Fluorescent dye stains the plaque yellow. It does not stain the soft tissue, but special light is required to see the stained plaque. It is more expensive. Two-tone dye is a solution containing combination of two dyes. Mature plaques are stained blue while the new plaques are stained red. Main advantages of this method: it helps to differentiate mature and immature plaques. They do not stain the gingival tissues. Iodine containing solutions. This main disadvantages: high incidence of allergic reactions, unacceptable taste. Iodine solutions are so not preferred. Method of applications: first is painting the teeth with a cotton sap and rinsing the mouth. As tablet to be chewed, dissolve it in a saliva and the mouth should then be rinsed with water. Thank you. Thank you so much for your patient listening.